Whenever an incident occurs in which someone is injured or suddenly taken ill, always remain calm and assess the situation. Approach with caution. Do not rush in because in doing so you may overlook a hazard to yourself. Always take 10 seconds to follow these procedures of assessment. First, initial evaluation. As you approach the area, look about carefully for unsafe conditions that may require immediate attention. The first 2 seconds belong to you. Assess personal danger. If the scene is unsafe, do not enter, but call for professional help.
Candace, get the AED. Bill, call 911 and get the first aid kit. Mike.
Consider the cause of the problem. Is the injured person in danger of additional injury if not moved immediately? Second, call out for help. There may be another person nearby who can phone the EMS and/or get an AED and first aid kit. Before providing first aid treatment, identify yourself as a trained first aider and ask the patient for permission before doing so. If he is unconscious or an unaccompanied minor, consent is implied for life-saving care. Third, be alert for possible neck or back injuries. Special care is required at all times during the evaluation process if there is a reason to suspect that the patient has suffered a head, neck, or back injury. Maintain the body in the same position as found until the arrival of the EMS. Do not move the patient unless there is immediate danger of further injury or if it is necessary to provide emergency life-saving measures. Remember, it is not necessary for the patient to be lying down to check for normal breathing. If you must leave the injured patient alone in order to summon help, place him in the modified Haynes recovery position. Fourth, who needs help first? When there are several people who have been injured, the first aider must determine who is most urgently in need of care. Use the priorities of proper care as your guide. This decision-making process of quickly checking all of the injured and establishing an order of care is called triage. Fifth, your primary survey immediately follows the scene survey. It consists of a rapid evaluation of an individual's responsiveness and breathing. If you believe that trauma has caused breathing to stop, call out for help and begin CPR with 30 chest compressions followed by 2 ventilations. Perform CPR for 5 cycles, about 2 minutes, before leaving to call 911. Also included in the primary survey is a check for and control of serious bleeding. Sixth, determine the patient's problem. After providing first aid for life-threatening injuries and the patient is breathing normally, continue to observe the patient. While waiting for the arrival of the EMS, conduct the secondary survey. Determine if the patient has any other injuries or problems that need attention. Check for bleeding and fractures. If the patient is able to speak, ask the nature of the problem and/or the cause of the injury. Examine the parts of the body for which the patient has specific complaints. Seventh, notify the EMS. Phone fast. If you establish unresponsiveness in any of the injured parties and/or your assessment determines the need, initiate contact with the Emergency Medical Services System, EMS. Phone fast. In most areas of the country, this means a call to 911. In some outlying areas, this may not be the case. You must become familiar with the system used in your particular area. If the unresponsive person has been injured, always consider the possibility of spinal trauma.
Dave fell off the scaffold. Somebody call 911, get the AED and a first aid kit.
Hi, guy just fell off the scaffold. We need an ambulance at 4002 McNulty Road. Okay.
First aid for a spinal injury begins with prevention of spinal movement. Whenever possible, moving of someone who may have suffered a spinal injury is best done by the professionals of the EMS. Special care must be provided in order to protect against further injury by avoiding all unnecessary movement of the injured person. Move only if there is danger of additional injury to either the patient or the first aider, or if necessary to provide life-saving